We performed a screening or RF kinase screening where we identify FGFR1, a tyrosine kinase receptor, as a possible mechanism of resistance to CDK4 and 6 inhibitors. The CDK4 and 6 inhibitor, in combination with endocrinology, now are the standard treatment for breast cancer patients, estrogen receptor positive breast cancer patients. We found that when there is the overexpression of this receptor, FGFR1, these cells and mice, PDX mice, are less sensitive to the CDK4 and 6 inhibitor treatment. So we went to clinic to analyze some clinical data, and we saw that a cohort of 34 patients treated with the CDK4 and 6 inhibitor, we analyzed the circulating tumor DNA after the progression of this progression on this drug, and we saw that these patients show an enrichment of FGFR alteration, like FGFR1 amplification, FGFR2 amplification, or FGFR1 or 2 activating mutation.
Does this signal there's a targetable pathway for treating that resistance?
Yes, there are different FGFR inhibitor actually in clinical development. We have a clinical study ongoing at Vanderbilt University where we are evaluating the double combination, the standard treatment, anti-oestrogen plus CDK4 and 6 inhibitor plus or minus FGFR inhibitors. We are using erdafitinib. We are selecting the patients for FGFR alteration, I mean FGFR1, 2, 3, or 4 amplification. If a patient is estrogen receptor positive, HER2 negative, with an FGFR amplification, there is the possibility to ongo in the trial to receive this kind of treatment.
So would you recommend FGFR screening as something which clinicians should be aware of?
Yeah, maybe it's too early to recommend it, but different studies are ongoing. For sure, there is a different group are seeing the same that we are seeing in our clinical data, that FGFR1 could related with resistance. If we are able to confirm this data, for sure we have to investigate the FGFR amplification, or maybe better the FGFR1 overexpression or mutation to decide if these patients could receive a different kind of treatment.
Any forecast to when those trials might be concluding?
Yes, the clinical trial is ongoing, so it's too early to say something. We have to wait maybe next year to see some preliminary results.